Okay, so let's start our presentation. So as we said, the gestation diabetes. The gestation diabetes means what you expect from this topic. Like easy words, I have to explain like what is the gestation diabetes. Like it's a high blood sugar or glucose level that develop during your pregnancy and usually disappear after giving the birth. And this is true. Once any patient is diagnosed during the pregnancy, they have a sugar level is high. And believe me, when you deliver your baby, and automatically this will goes with it 24 hours, even within few hours, okay? But more detail I want to explain, like as you said, like any the glucose intolerance with onset of the depression during the pregnancy, whether or not the condition persists after the pregnancy, or not excluding the possibility that unrecognized glucose intolerance may have intended to begin concomitantly with the pregnancy. Diabetes occur in 1 in 7 women or pregnant women in the worldwide. The prevalence of the diabetes in the pregnancy has been increased all over the USA, or we can say all over the world. But we can say now these days, when we do our studies and all these things, we have to see the gestation diabetes increasing in the Gulf country as well. In parallel with the worldwide, the epidemic of obesity only in the prevalence of the type 1 diabetes and type 2 diabetes as well. When we see any patient when they diagnose the gestation diabetes, so we are expecting them maybe they will develop like type 1 diabetes during the pregnancy, or maybe expected to type 2 diabetes after the delivery, especially in the women of the reproductive age. But there is also the dramatic increasing in the reproductive rates of the gestation diabetes varieties. The diabetes confers significantly greater maternal and fetal largely related to the degree of the hyperglycemia, but also the chronic complication and comorbidities of the diabetes. So what is the background? So background means when we see like there's many different kind of the condition can happen during the pregnancy, like we can say easy words, macrosomic baby, like large size of the babies. Many women can develop the uncontrolled sugar level in the pregnancy, so they have a spontaneous abortion or repeated abortion, or they have like we can say it's like the anomalies during the pregnancy. The baby is not look normal during the when you do the anomaly scan during the 22 weeks of the pregnancy. Neonatal hypoglycemia means that during the birth of the baby they have a low blood sugar level. Hyperbilirubinemia is very commonly word when we see the baby have a jaundice after the delivery. Neonatal respiratory distress syndrome means the newborn can develop the chest infection after the delivery because of the uncontrolled sugar levels. Among other, we can say for the mother, for example, they can diagnose during the pregnancy when we call diabetic during the pregnancy. They have increased the risk of the high blood pressure, we call hypertension, for type 2 diabetes. That means they are depending on the later in life, maybe only for the medication, oral medication, or maybe the insulin level. So as we say, these all the women, they are in the risk factors. So mostly the risk, who's in the risk factors? So this is, we can say high BMI, like whoever have a high BMI, like high weight, increase in the weight during the pregnancy because of the sugar levels. Or we can say, we can ask them to use the healthy calculator, like control the blood sugar and the weight as well. So we have to be calculate the BMI always with the height and weight. The previous and other rules, like in the risk factors, we can say mostly they have a previous pregnancy. For example, you have previous pregnancy and you have a baby weight like more than 4.5 kilo, or maybe nearly the 4 kilo. So they are most, we can say they are the one macrosomic babies, like more than the average age of the fetal during the time of the birth. For example, until you are 37 weeks and 38 weeks of the pregnancy, in the last few weeks of the nearly the pregnancy, and your baby weight is coming 4 kilo or 4.5 kilo, and with the high blood sugar or uncontrolled blood sugar level, so we have to decide for your delivery as soon as possible. And the gestation diabetes in the previous pregnancy, yes, whoever diagnosed already with the previous pregnancies, maybe this is your first pregnancy, but you're already with the insulin, or you're already with the glucose blood sugar medications. So you also have a high risk for this gestation diabetes. Maybe from your family, your mother, your father, or maybe anyone sibling already have diagnosed with the sugar, they are taking the medication. So 50% and the mother have a chance to develop the gestational diabetes during the pregnancy. Mostly in the South Asian or Black African, Caribbean, or Middle Eastern origin, especially we can say the Gulf countries as well, they have a prevalence rate, for example, type 2 diabetes is 3.9 to 18.3%. GDM means the gestational diabetes percentage is 5.1 to 37.7% in the Arab Gulf countries. So in the journal, when we see if the patient they have a risk of a diabetes during the pregnancy, they have the, like as I already explained, like there's chances for the spontaneous abortion, because sometimes when you are in the early pregnancy, like in the first 3 months, and you didn't diagnose your sugar levels, and then you're not going for the regular checkup, and you're not doing your early checkup for the blood sugar, of course, there are the chances for the repeated abortions. So always we are explaining and we're counseling our patients, please, when you diagnose your pregnancy and viable pregnancy, that for example, you are diagnosed like 7 weeks, 11 weeks, 13 weeks, so you have to go full checkup, full your blood routine test. So at least you have to be, you can check like your sugar levels, and that in case if you are a chance for the developing the sugar level, so you have to be conscious, and you have to know how to go for the proper follow-up checkup with the dietitian, with the endocrinologist, the one who controlling your blood sugar, or your obstetricians. Fetal anomalies, as I explained, many babies we can see in the heart problems, many babies we can see in the brain anomalies, kidney problems. So they have like during the scare we can check with them. So you have to be controlling your blood sugar to avoid these anomalies can start with the baby. Preeclampsia means the high blood sugar during your pregnancy, especially early 20 weeks of the pregnancy. We can find high blood pressure, you can find protein in the urine, and other symptoms with the preeclampsia. So you have to be prevent this to start the preeclampsia during the uncontrolled sugars. Fetal demise means many times we heard about the blood sugar was not controlled, and the mother they are saying we cannot control our diet and our sugar was uncontrolled, so baby can die actually. So this is the main important thing. We have to be controlling the sugars to prevent again for these complications. As I said, the macrosomia baby, this is the like a large size of the babies, or 4 or 4.5 kilogram of the baby's size. And neonatal hypoglycemia, like sugar level is going to be reducing during the time of the delivery. Hyperbilirubinemia, like jaundice, and this is the same repeating again, but as already we discussed about these things. So you have to be know about the basic things, how the complication can start during the pregnancy if the sugar level is not controlled. Symptoms of the gestational diabetes. Yes, once you see the symptoms, if you have most cases, only discover when your blood sugar level are tested during the screening or gestational diabetes. When you come to your doctor, when you go for them, and they are explaining you after the 22 weeks of the pregnancy, and you see, we call them always, we do the glucose test. For example, if your glucose level is high and you feel something like, you don't know, but you're feeling like you're increasing your thirst level, you are drinking more water during the day, you feel more thirsty, and you want to go to toilet to pass the pee more frequently, your mouth always dry because you need to drink more water, or maybe you are tired. So once you see this very similar accused symptoms, if you feel it and you don't know your sugar level is high, so you can check with yourself either you have these symptoms or no, if you didn't do until your glucose sugar test properly. How the gestational diabetes can affect the pregnancy. This is very important. Most women with the gestational diabetes have otherwise normal pregnancy with the healthy babies. The baby growing larger than usual. Yeah, this may be lead to the difficulty during the delivery and increase the life product, induce labor or cesarean section maybe. When we do the scan and we find that we explain always our patient, please see this one. For example, if you didn't do the blood sugar level and you don't know that sugar is high, so when we do during the scan, the water of the baby's, the fetal water is very in the high level. Then we ask the patient, you have a high level of water in your tummy for the baby, you have made chance for the increase your sugar level, please go ahead and do your blood test as soon as possible. So mostly we call like polyhydramnios Or if you have a polyhydramnion, for example, you have 30 weeks and your water is coming more than 20 centi in all over the pocket and all over the tummy area. So you have made chance for the premature deliveries or premature birth as well. So there is more chances that we can say preeclampsia, baby developing with the low blood sugar levels, and then they may start the jaundice after the delivery. Maybe we can examine their eye, and then after he or she born, which may be require a treatment in the hospital. For example, if you have a sugar and you are on the insulin or you have on the glucose level is high, so and you're not controlling with your medication. So as I said before, like baby can have a jaundice during their delivery, and these kind of the babies may be admitted in the hospital after the delivery due to the high level of the jaundice levels. Okay, stillbirth. Many times when we see there's early pregnancy, early premature babies can deliver due to the high level of the water, and they have more chances to be rupture the membrane, and they can deliver early in the premature level. Like before 35 weeks of the pregnancy, we call premature deliveries. So there is increase the chance of the type 2 diabetes in the future, because if you're not controlling your sugar level or you're not taking properly care for your diet and you're not taking the insulin or medication, whatever prescribed for your doctors, and you have more chances to develop the type 2 diabetes after the delivery. How to manage of the gestational diabetes? We can say is a checkup, how you go for the doctor routinely. Whoever have diabetes and they are pregnant, we offer them to immediately contact with the joint diabetic clinic. Like there, you have to go to your consultation with your consultant or the obstetrician, and you have to go about the endocrinologist, the one who is controlling your sugar levels. And you have to be visit at least once or twice in the month for the dietitian. So they will explain you how to continue your diet during the pregnancy. Should we contact with the dietary care team for the assessment of the glycemic control every 1 to 2 weeks? Yes, you have to go for at least once a week or one time in 2 weeks. So you have to go with the dietary clinic. You have to talk with them. They will advise you about your blood sugar levels. They will advise you how to check with your blood sugar levels. And you have to start the medication or just only for diet control, or maybe some they can start the insulin. So this is very important to contact with your dietary clinics. At each appointment, women should be ongoing the opportunity for the information and education. Yes, whenever the patient coming to our clinic, we are giving them education, like we're giving them a little bit small lecture or small class about to talk about sugar level, how to control. And for example, during the clinic time or ultrasound, when we see the water is going high in level, and then they have some kind of the symptoms and the sugar level is high. So we always advise them you have to do your blood sugar checkup like before and after the food. For example, if you already have the glucose test is already high, so you have to go with before fasting and after 2 hours of fasting, you have to check the blood sugar level. The specific antenatal care appointment with the diabetes. First appointment, run the diabetic calendar clinic, including the diabetic related complication, like you have to review the medication, diabetic related and renal assessment. So we advise the patient already they are on the insulin and they are taking their own medication. So we ask them please go to the eye checkup and go to the renal for the kidney checkup, because this is very nearly related with this complication during the pregnancy. So first visit we have to do with the 7 to 9 weeks of the pregnancy. You have to confirm your 1 week of the pregnancy, and then second checkup you have to go for the 16 weeks to 28 weeks of the pregnancy. So this is to attend my second trimester lecture. So you know we do the anomaly scale in 20 to 28 weeks of the pregnancy. So this is the main important time. We have to check the baby heart. If there is a cold check or heart, we have to see the outflow rate of the heart of the fetal, and then we have to go over the detailed anomaly scale. And the glucose tolerance test, there's a 2 way to the glucose tolerance test, 50 grams and 75 grams. So most probably with the new study, we are always advising our patient to go for the 75 grams of the glucose test. They will give you the glucose to drink it, and then they will check for you the 3 hour blood test. It will be like 24 to 28 weeks of the pregnancy. The last trimester, you have to go for the 36 weeks onwards, or for the fetal growth and fetal fluid. And the blood sugar monitoring, we can go for the HbA1c, which is also very important to do the blood test. Fasting and blood sugar, as I explained, like you have to be checked at your home. 30th week plan for the whoever has diabetes in the pregnancy and sugar level is higher and controlled in the pregnancy, already you're diagnosed with the gestational diabetes. So we explain you, you have to be deliver as soon as possible, at least 38 weeks of the pregnancy with the induction of the labor if you're not in the active labor. So we have to be induced with you some bloodstream recall or maybe on the induction, or maybe we can see the baby weight is more than 4.5 kilo. So we have to advise only the patient to go for the cesarean, which is safe side. GTT test, as we said, mostly in the government setup, they are giving with the 50 gram glucose. In the private, we have both facility available, 50 or 75. If you already diagnosed, you already have the medication for this patient, no need for the glucose test because already you are on the medication. But somehow they want to new for the first time you are pregnant, or maybe you have a second or third pregnancy. For this case, we have to be advised always our patients to do the glucose tolerance test. It should be 8 hour fasting in the, from the night to the morning, and then you have to be go for the blood sugar checkup. They will give you like 50 grams of glucose to drink, or maybe the 75 grams of glucose. For the 50 grams, it's the same. You have to be 8 hour fasting, and they will take you only 1 hour of the blood sugar test. But in the 75 grams, they will take you for the 3 hours. During these times, maybe when you are not eating anything and you are fasting, you can drink water only, but not any other foods. Okay. So, but when we do this one, now the new study said we have to go further before the 28 week of the pregnancy. We have to check the patient's glucose test. If you have to previously diagnosed with diabetes, for example, this is very simple readings. I'm just going to share you. So, for example, if you're checking your blood sugar at home, so you have to know how much the sugar level will be normal and how much will be more than high. So, for example, if your fasting is more than 92, for example, in between 100, this will be normal before fasting, okay, in the fasting time. But if you check in the millimole, it will become like a 5.1. Okay, 1 hour more than 180, we can say, but most probably when we see this. This is like 75 gram glucose. Okay, this study reading is that 75 gram glucose. But when we see any patient is coming like 10 and then more than 2 hours it's coming 8.5 or 3 hours it's going like 7.8, they think this is the high levels. For example, if you see first reading is coming 3 or 4, this will be normal. When we see it's 5, nearly 6, it will be high. We can see some patients that in the report to us, they said they showing like 9.5. No, this is also borderline. We have to be calculated as a high level. Any patient when they have an 8.5, nearly like 8, so this will be high. So as we say, 2 step of the GTT, 50 gram, as I discussed already, it will be like the step for this 24 because it is same, but if you don't have any previous history, it will be the same like 8 hour fasting, but if 1 hour blood loading is coming more than 140, it's like a high. Okay, even 140, high, we have to go for the second step, like glucose tolerance test for 75 grams. But if it's coming like 120, 130, even we can calculate it's like a normal. So if you go for the minimum, it will be like a 7.8 minimum. Then proceed to the 75 the glucose test if your sugar level is coming like more than 7.8. Even if you are 7, we call that borderline. We have to go for the second option, like 75 grams glucose. How to monitor your pregnancy? The gestation diabetes can increase the risk of the baby developing the problem such as growing like larger than weight. Because of this, you will be offered the extra antenatal appointment with your consultant. And then finally, you should be offered to do like an ultrasound at around 18-30 weeks of pregnancy to check your fetal abnormalities. Ultrasound scan at 28, 30, 28, 32, and 36 days is very, very important to monitor baby growth. We call Doppler scan or growth scan, and amount of the fluid is very important. Once we find in the 38 weeks the fluid level is very high, this is the first alarm for us to explain our patient to have to go further. Glucose test is still using the glucose tolerance test like GTT. So we have to be calculate, like as I said, the monitor of the growth of the baby and amount of the fluid plus regular checkup until the 38 weeks. If the woman with the breast is bad, she has a more BMI, like the weight is more than 37 kilo. So you should start the restricted diet. And this diet is very important. For example, you have to be check the calories is like 25 calories per kg weight per day or less. So if you do moderate exercise, yes, the moderate exercise, you have to go regularly 30 minutes every day. You have to start the exercise. With the diet control and exercise together, at least within 2 weeks, you should maintain your blood sugar as well. Otherwise, if you're not going to control your blood sugar levels, and then you're just doing the exercise without your controlling your food, you will start other symptoms. So when you, as I said, you have to exercise within 2 weeks, try to maintain the blood sugar, then have a glycemic therapy, you can start. So it should be considered like lifestyle. We already explaining our patient to change your lifestyle, and we have to start medications if you're not controlling your blood sugar. If we check the blood sugar already diagnosed and you are on the medication, so we have to be checked every 3 months, like HbA1c blood test. This is also another type of the blood sugar control, but for this test, no need for the fasting. Only you can do directly to check every 3 months or every 2 months if you feel your blood sugar is not coming normal. So if below 7, the HbA1c will reduce the risk of the prenatal formation. You may be advised how to control that if regularly you eat 3 meals a day, but should be 3 meals is complete meal. Avoid skipping meals, okay? Because if you avoid, like you are sleeping too much time and you are eating just only twice, like one in the morning and one in the night, so you will start the hypoglycemia because your blood sugar is sometimes, so taking the medication, it will reduce your blood sugar level. So you have to take proper meal each time. And then you have to eat especially a low glycemic index food related to they're releasing the sugar slowly, such as the whole wheat, pasta, brown rice, primary wheat, all grain cereals, pulses, beans, and lentils. This all the food is so we call like less carb. And then eat the plenty of fruits and eat vegetables and for at least 5 portions of a day. So you can make if you cannot eat like you're going second in line of the second trimester or third trimester, you cannot eat the proper full meal. You can split your food like 3 hours, 4 hours each meal. Then you have to make your portions of it, and then you have to try to reduce your carbs as much as you can. Avoid the sugary foods. You do not need a completely sugar diet, but you serve the snacks such as the cakes, biscuits, chocolates, chips. These are all the things you have to avoid. Alternatively, you can choose like a fruits, nuts, and seeds. The fruit, one food or maybe 2 foods one day you can take it, or maybe the portion of the food you can take if the sugar is not controlled. As we said, why the sugary drinks like diet or sugar-free drinks are better than the sugary versions. When you go to the market, you will see there's a different kind of the juices out there. So you can find like less sugar. Less sugar means no sugar is available in the market. So you can take it this kind of the juices. It's good for you. And then you have to go for the fruit juices and smoothie also is high sugar. So try to avoid these things. So you can get some like age drinks also. You can check like the nutrition label. So always you have to check when you start to eat it. You have to avoid the ice cream as well. There is different kind of the foods available. They say they look like a sugar, but they say it's less sugar without sugar. So always try to get it without sugar. Eat the lean sources of the protein such as fish. Fish is very important. You have to get twice a week the fish. It's also important to be aware of the foods to avoid during the pregnancy, such as the second type of fish and cheese. That also we discussed in our last presentations. So we are just showing you this one is the chart of the diet. So this is very important when we see there's a different kind of the food. You can see here, you choose your choice. You can find very nice pictures from here. You can see there's some kind of very healthy vegetables out here like the broccoli and the mushrooms and carrots and zucchini. You can try to take these foods, and there's like we said, we divide. So when we see like these foods, when we see we can explain about the carbohydrate also here. With the carbohydrate means when you're taking some breads. So this bread is like you have to take like a brown bread. So brown bread is available in different kind of the breads, but we have to take it like the cup of brown bread with the base, the yeast or something like this, So you have to avoid these kind of brown breads. So we call hypoglycemia or macrosomia baby. This is a very complication important to discuss about this. When we discuss about women, like the pregnant women, when you have the baby weight is increasing, like for example, you are 34 weeks of the pregnancy, but your baby showing 36 weeks or 37 weeks, this is not normal. Okay, that means your sugar is not controlling. You are not controlling your diet as well. So when we ask the word, we are using the macrosomia. That means this kind of the baby, especially we can find in the uncontrolled sugar levels or the diabetic in the pregnancy. So these kind of the babies, they can developing this like during the time of the delivery. When we say the cephalopedia disproportion means when we deliver normally, for example, about 4 kilo of the babies, many women that they came to us, like many mothers during the pregnancy or the previous pregnancy, they giving the history that we deliver normal 4 kilo baby. Yes, they deliver. It depends on every patient's body structures. And the second thing, maybe they are showing in that scale like 4 kilo, but in the time of the delivery maybe it's 3.5 or 3 point something. But in case if you deliver 4 or more than 4 kilo of the baby with a normal vaginal delivery, always they suffer like shoulder dystocia, like breaking the shoulder of the baby because of the pushing and delivering the baby. So we have to avoid always this shoulder dystocia during the pregnancy time. So better to be advised in the early, and discussion is early is very important in 30 weeks of the time of the delivery for the baby. Either it's going, as I said, it's 4.5 kilo baby, they have to go for the cesarean. And then after that, increase the fetal weight between the advanced gestation age as well. Like, for example, if you're 37, 38 weeks of the pregnancy, automatically the baby will show with 40 weeks. So this is the main thing we are deciding to deliver in 38 weeks of the patients. So when you decide for the delivery ingredient, this is the doctor actually deciding, and explaining our patients. This is very important. We have to know everything. So, for example, if you are less than 39 weeks and maybe more than 39 weeks, so we have to divide in different ways. For example, if you are past obstetric history, maybe you have a previous history like a pregnancy loss. Maybe anyone have a previous intrauterine, the baby was died in the pregnancy. Because of the high uncontrolled blood sugar level, so maybe they have a big side of the baby, so maybe they have a previous cesarean with the sugar level is high, and they diagnosed with the gestational diabetes. So this is the main thing. We have to go directly with the less than 30, for example, 39, like 38 weeks. We have to decide for this because of these reasons. Okay. If anyone is diagnosed already with sugar but it's controlled and only in the diet control, we can wait like more than 39 of the week. But there's no history left here, okay? Current obstetric factors means the current pregnancy, what we're going to do, like for example, if any patient may loss of the fetal moment, for example, you are in 37 weeks or 38 weeks, and any woman when this crossing these weeks and they feel the moment is not too much like before. Because what happened when your sugar level is coming high, so that time the baby and automatically you have more water inside the tummy or maybe less. So, but your sugar level is high and the baby fetal moment is not good. Maybe you, as I said, like for example, 37, 38 weeks of the pregnancy, your fetal moment could be 12 times, like 15 times in 24 hours is normal. But you feel in 5-6 hours only one moment or no moment at all, you have to rush to the hospital. So that means we have to decide for the patient to deliver as soon as possible. Macrosomia, like as I said, more than 4,000 grams or 400 grams, like 4,000 grams of the baby. So we have to decide for the pregnancy about more than baby how we deciding for the delivery is normal or for the cesarean. If you're diagnosed already with a GDM and you're more than 39 weeks of the pregnancy, the optimal fetal-maternal heart is any something is coming not normal, so we have to decide for the delivery. Medical factors like compromised placental maturity, if there is any problem with the placenta or maybe or maybe they have a problem with the or maybe they have a problem with the blood when we check the blood sugar, blood test with the kidney profile, it goes up and down, and it's not look normal, so we have to go with the delivery as soon as possible before the 39 weeks. If, as we said, you have more than 39 weeks already you are, and there is nothing happening like all is going great, and the blood sugar is controlled, and there is no complication in this current pregnancy, so you can wait until you're okay, so when we say an guys decision any for the late pregnancy, late early term delivery or before 38 weeks or plus 6 days, yes, it should be recommended. Yes, we are always advising our patient when you already diagnosed and you have with the 38 weeks, you have to go for the delivery as soon as possible at 38 weeks plus 2 days. Or the baby weight should be more than 4 or 4.5 kilos, so we have to go for the cesarean deliveries at the 38 weeks of the pregnancy. During the labor and delivery, your blood sugar was not sugar will be like monitoring and keep under control. You maybe have insulin while you're during the time of the delivery. We advise the patient to give you the insulin during the drip. Yes, this is the main things we have to control your blood sugar level during the time of the delivery. Gestation gap is normally goes away after the birth. Yes, this is true. Many women from the pregnant women when they deliver in the same time, in the same 2 hours, the blood sugar become normal. But this is very important. You have to be checked the blood sugar level after the delivery until 2 weeks, like 2 weeks, 3 weeks, maximum 4 weeks. If you find your 2 weeks until your sugar level is getting high, you have to be continuing with your diet control and you have blood sugar monitoring. When you have blood sugar test to check to your diabetes 6 to 13 weeks after the giving birth, and once every year after the result is normal, then it's fine. No need for you to go for the again checkup. Two weeks your blood sugar coming is normal, then you have to start monitoring your blood sugar level. See your GP if possible, GP or your obstetrician or any doctor when you're consulting with them about the high blood sugar levels, and then after the delivery. And you have the same symptoms like you still your thirsty or the toilet frequently, and then you have a symptom like say like in your pregnancy, so you have to be consulted with the doctor as soon as possible. As you said, some research has suggested the babies of the mother who had the sugar diabetes may be more likely to develop diabetic become obese later in life. So this is the main thing to be give you the counseling or awareness about the sugar levels, and then how we have monitored, how we are deciding, and why we are deciding the delivery. This is the important presentation. So we have our presentation is end up here, but we have some package, like we have new package for the maternity package or antenatal checkup package. So we are advising you if you feel comfortable, please feel free to ask questions, or you can see here now we have normal delivery. It's 450, and the cesarean delivery is so this is the antenatal package. Here we have first trimester, we have we can say up to 12 weeks. It's HGB package. We have many blood tests included when you're doing the ones during pregnancy. The second one is the second trimester 60 baby. We have some scans and some blood tests, and third trimester is when we have some ultrasound included with the CTG, and we have blood tests. So please, any question if you have, just write in the comments, so I will reply you.
Good morning, Doctor. Good afternoon. Doctor, sometime we will do GTTB for the patient at 24 weeks, and we will get the reports it's normal, but later on we will see that patient is getting more weight. She will gain more weight. There's chance to be like at 32 weeks. We can repeat the GTTB for her again, just to be sure that maybe she's a diabetic, and maybe at that time it was normal and then she become diabetic, gestational diabetic.
Yes, Anna. See, what happened actually when we see in early pregnancy, many patients actually, I see many patients when we see the sugar level was high, even the fasting random and the glucose tolerance test, all the readings were high. When she crossed like 28 weeks or 30 weeks, even 34 weeks, suddenly they start the lighter was very high. When we see the lighter is high and she's increasing the weight without any reasons, maybe her diet was very, unusual, and then she, as I said, the symptoms she has. Yes, you have to go ahead with the glucose tolerance test. At least if she cannot do the 3 times, you can go for the 50 grams as well. And the important thing, many patients really I saw they don't like to go for the glucose test. Tolerance test. I know the taste is not like they are thinking. The taste is sometimes is not good, and they have a nausea, they have a vomiting. So for this patient, even is not helping them. So easy way, you can go for the HbA1c. You can do them. If you see the HbA1c is high, then you can ask them, please at least do one more time 50 grams. If you see it's showing like high, then they have to go ahead. One I missed, I think I want to discuss, like, for example, if you see like this cases and you are advising that go for the HbA1c and you find this is high and she don't like to go for the glucose test, easy to ask them, control your diet, and then she have to do it like 6 blood readings with the glucometer. For example, before fasting, 1 reading. After 2 hours of the fasting, she have to eat something. After 2 hours, you can check 1 more reading. And then same like in the lunch before and after 2 hours, and dinner before and after 2 hours. So what will happen, at least 4 days to 5 days or maximum 1 week, she has to control her diet, and before and after 6 readings, you will find how many readings is coming higher, and then you can conclude, and then you have to start her upon your findings, like for example, she needs to be a diet control only. If you feel that all the readings is coming normal, she has to be continuously diet control until the delivery. Or if you find like if she has high readings, like 3 or 4 readings in between the 1 week, you have to start with the glucopage at least 1 or 2, and then you have to see again 1 more week with the same readings, and then check again the sugar level how it's coming out.
Good afternoon, doctor. Doctor, just I want to ask about the sugar checking machine. Is it giving accurate results, or just better to follow the lab result, lab checkup?
Can you repeat again, please? Zainab, can you repeat again the question? I didn't hear it.
Good afternoon, doctor. I'm asking about the sugar checking machines, the normal from the pharmacy. Is it giving accurate result, or better to check with lab report, lab checkup?
Can you write the question in the comment, because the voice is not coming for me. Zainab, can you write please in the comments here? Because your voice is disconnecting and I cannot understand the question. Sorry for that.
Good afternoon, doctor. Can you hear me?
Yeah.
My question is regarding the period where we are doing the GTTB. It's written specifically, according to our guideline, 24 to 28 weeks. Does it mean if I did it after this period, it won't be accurate? Means sometimes ladies, they are coming in late period of pregnancy, like in third trimester. Does it mean that their GTTB won't be accurate? It will be wrong reading?
So what I understand your question, if you can write here, it's more easy for me. What I understand, you said there's some women when they diagnosed in the neck, the dates is not correct, yeah, and they are pregnant. After that, I don't understand your question. It's something is coming the issue with the internet. Please can you write here in the comments the question? sugar checking machine is implemented and then to follow the box of yeah. And you ask the question. Simon, see there, you said the sugar checking machine is accurate or better to check the color. See, the problem, if you're at home, sometimes when we ask our patients to go for the 6 readings, okay, they cannot go for the hospital. You are right, sometimes the machine is not accurate, but mostly we are depending on this machine at home, especially for the patients. At least, for example, if some readings is not coming correct and the patient, we are asking, yes, doctor, we take this food in this time, that's why my sugar is coming high. When we see the comparing the other days and other timing, the readings are not there. So we have to trust them, and then if someone have a facility for the fresh blood test with the laboratory, why not? So what happened when we ask the patient and the patient they say, no, doctor, my readings is normal, I control diet, I do exercise, maybe the machine is not correct. I said, okay, no problem. So you have to come like at least 1 or 2 days between the week. You have to do the fasting in the laboratory, and then after 2 hours of the fasting with the blood sugar in the laboratory, no problem. So we compare always about these things. So you can do the same as well. Voice is not clear to say. Yes, the question is the GTTP done after 28 weeks gestation, is the result will be accurate? See, Zainab, what happened before we do the glucose tolerance test in 22 weeks, yeah? When we do for the anomaly scan, that time we're doing. Now the new study says we have to go for the 24 to 28 weeks. As you said, when after the 28 weeks, is the result is accurate or not? See, depend on the condition. For example, if you go for the GTT, it's the same way. Like, for example, if it's coming like 40, for example, it's a gram for 50 grams, if you're going for the direct 1 test or 3 tests. So after 28 weeks, we don't go for the 50 grams. We always go for the 75 grams. So at least there are 3 readings. For example, in 3 readings, there is a 1 or 2 readings high, so we have to manage the patient accordingly. I hope it helped with the answer. But more better than do it and nothing actually. Yes, we have. Yes, we have this one. The 60 reading, we have the glucose test. Is involved already, yes. Any other question, please? Actually, see, now these days, if you know the patient when we see them, like they have going to the surgery, okay, or bariatric surgery, they go for this. Many women they reduce the weight and they are pregnant and they come back to us. We are suffering with these patients. They don't tolerate this glucose, and we tried them at least 150 grams. Even the 50 grams they cannot drink it. The woman. This is very good question. As you said, can we depend ACPC for the patient who are not tolerating electricity? We don't have other options actually. So when they don't do it, so we go for the ACPC and then we have to go for the like HbA1c. So we will depend only for this, and we will depend about the history and then identical checkup and the anomalies as well. So we will be very restricted for them because we have to be very carefully monitor for this patient because we don't have the glucose test for this patient, So this patient will be, of course, somehow if the family history very strong with the family, so we have to be monitored very carefully for this patient. So second trimester has only TB test or also some factors of it. I think my colleague Leslie, she will send you the message, okay, about full detail 60 BD. We have some blood tests, we have ultrasound included, we have the antenatal checkup as well. The 60 BD test. But in our package, we don't keep the anti-scan, we don't have the anomaly scan, and this is a little bit separate actually. But mostly we have normal scan, like normal checkup scan, we have in the some included in these categories. So thank you so much, everyone. Hope you understand, and please, your feedback is very important for us. And then we'll wait for your feedback. Thank you. And anyone you now, if you want to need any other topic, please send us message about the feedback. Thank you so much.